advance a little bit so that folks can log in, and please type into the chat your location, role, and something that makes you hopeful about working with fathers and father figures. So while folks are doing that, I just wanted to provide some context for our discussion that grounds this work while folks are able to answer this kind of question and log in. So in recent years, programs, organizations, and even systems have been reframing the concept of family in ways that are more inclusive, broadly acknowledging the roles of foster families and extended family members and kinship caregivers in the lives of children. However, although research has demonstrated a range of positive child and family outcomes can result from father involvement in a child's life in our systems of care work and human services work more broadly, we still have a lot of work to do to meaningfully and intentionally engage, recruit, and retain fathers and father figures in our programs and systems. To illustrate many of these points, in a webinar we offered last week that I hope many of you were able to join, we heard from an amazing grandfather, David Armstrong, who accompanied his grandson with behavioral health challenges through multiple systems and struggled to be included in programs that were designed for mothers and children. So while David was able to leverage his personal experience of confronting bias against dads and male caregivers to create a national platform, what about so many of the other fathers and father figures that are not able to invite themselves to the table? Our work in this community of practice will be focused on more comprehensive approaches to engage fathers. So I'm Pamela Trevetti. I'm one of the leads for the Infant and Early Childhood Mental Health Transformation team at our center that supports children, youth, and family mental health. I'm really excited to be embarking on this work with you all, especially because as a school and clinical psychologist, I've also spent many years working to understand and in some cases move past how my own family experiences with my father went to get to a place of openness for engaging with dads where they are. In our community of practice, we're going to be hearing from folks from applied research and programs, and also from more advocates like David with lived experience navigating multiple service systems that are involved in our early childhood systems of care work. To kick off our COP today, we will hear about a framework from our colleagues that has emerged from recent research to facilitate father engagement. I'm going to introduce our speakers in a moment. Just wanted to go through a couple more introductory slides. We're doing this presentation today as part of our center, NTAC, and it is under a cooperative agreement funded by the Substance Abuse and Mental Health Services Administration, and all of the content that we're presenting today are sort of not a direct reflection of the Department of Human Services or of SAMHSA. So unfortunately, in recent events, we've had a couple of issues with security. In case there are any security issues, we'll stop the session and you'll receive separate communication about how to proceed. I'm sure everything will be fine today, but we just have to put that out there. So just a little bit about our center, NTAC. We're a multidisciplinary team comprised of many great national partners. And our goal is to provide innovative, responsive, and multimodal training and technical assistance that supports systems level change and the advancement of evidence-based and culturally responsive practice. So we're comprised of our audiences, and I hope lots of you folks are on the line today, our state and local agencies. We have lots of mental health practitioners. We have primary care providers, folks from schools, community-based providers, and lots of great family partners and peer support folks. And here's a very pretty model that someone with much better skills than I put together that describes our work. And a lot of the products that we already have. We are working on our programming and getting more of our products for the infant and early childhood transformation team out. So you'll see more of that. I know we email you folks all the time. So without further ado, I do want to turn it all over to my great colleagues. So Emily Hopkins and Matthew Conayer are very good colleagues of mine. They're federal colleagues who work at an office within the Office of the Secretary in the U.S. Department of Health and Human Services that uses research and policy to improve HHS programs And they've been working on a really helpful research project that I think can influence all of our practice. So I'm going to turn it over to Emily first. Go ahead, Emily.
Thanks, Pamela. Let me share my screen.
Oh, Emily and Matt, did you want to introduce yourself really quickly first?
Yes, we will. So thank you so much for having us here today. We're excited to have this opportunity to join you at InTech at this community of practice on engaging fathers. And we'd also like to thank Pamela for inviting us to be here with you all today. We want to acknowledge the experience and the expertise of everyone in this room. As federal staff, it's really valuable for us to have this time with you today, and we greatly value your insights and wisdom that you have. So for introductions, my name is Emily Hopkins, and my colleague Matt Canoyer is with me. We're from the Office of the Assistant Secretary for Planning and Evaluation at the U.S. Department of Health and Human Services. So our office is a policy office, which means that we ourselves don't run any programs, but we conduct policy research across a range of human services programs. And so today we're going to be talking about some of our findings from this project called Key Programmatic Elements of Father Engagement to Promote Self-Sufficiency, also known as Keep Fathers Engaged. And so this is an ongoing project with our contractors at Mathematica, which is a policy research firm. And we will be sharing some initial key findings, including promising approaches and strategies for engaging fathers. So for some background on our project, so Keep Fathers Engaged is focused on identifying strategies that various human services programs use to engage fathers with the goal of improving outcomes for fathers, children, and their families. We're interested in strategies used not only by fatherhood programs, by a range of human services programs, including those that may not traditionally work with fathers, including WIC, Healthy Start, child support, and home visiting programs, among others. Lately, we've been working to recognize that many human services programs have historically excluded or ignored the role of fathers within families, but we're working to kind of leverage fathers' desire to be a good dad and how looking at leveraging that can help advance program goals and improve outcomes for children, fathers, and families as a whole. So this project involved a scan of programs across the country where we interviewed program staff about their work and promising strategies that they use to engage fathers. Additionally, we had a panel of fatherhood programming experts who provided really great insight into some of their work as well. And all of our data collection is complete. And so we're now working on analyzing the data and producing several products, which we'll talk about a little bit more later. But we're hoping that these products will be helpful to practitioners and other federal program staff, including things like case studies, issue briefs, and webinars. So one of the first things that we did after data collection was complete was creating a definition of father engagement. And so this is our definition for our project that says father engagement refers to the purposeful inclusion of fathers, including those who are biological, social, resident, non-resident, and stepfathers in program services and activities with the goal of improving outcomes for fathers, children, and families. And so we say purposeful inclusion because we're really focused on thinking about like programs that are intentional about how they're including fathers in their services. So this is our framework that we've developed with our goal at the top is promoting father engagement. The next step down, you have the levels where father engagement can occur. And so we're looking at the program, organization, and system levels. So the program level talks about elements or practices of programs that are critical to enhancing father engagement. So this can look like efforts from practitioners that are working to engage or recruit fathers into fatherhood programs. At the organization level, this looks at characteristics of organizations that influence how programs as a whole can engage with fathers. And so this could be organizational leadership, such as the executive director, or how programs are working across human services to engage fathers at different levels. And then at the system level, that focuses on policies and regulations and guidelines that are may or may not be outside of the control of an organization that can impact father engagement. And so over the next few slides, and then the next level down are approaches. So there's different approaches within each level that programs, organizations, and systems can take to engage fathers. And they're, over the next few slides, Matt's going to talk about some specific strategies at each level and what that looks like.
Hi, everyone. Thank you, Emily, for going over all of that. And as Emily said, I'm also an analyst in HHS at the Assistant Secretary for Planning and Evaluation Office, and I work on the Family and Community Policy Division. So we work across a range of human services issues that affect low-income families and individuals. So now that Emily kind of gave you a sense of that overall framework that we're working with, I wanted to go into a little bit more detail on some specific approaches and strategies that the programs and organizations that we've spoken with highlighted as effective for them in increasing their father engagement. These may or may not work for your specific context, but I think they give a sense of some of the practices that do ring true across a range of different types of programs and programmatic areas. So we'll go through kind of the program level, organizational, and system level in turn. Starting with the program level, one of the key overarching themes that we heard about from a number of different programs that we spoke with was the importance of really tailoring recruitment and intake methods in a father-specific way and working within the program to create a father-friendly service environment and trying to do a good job of thinking about this across the whole timeline of engagement with someone in the program. So starting with the early recruitment efforts and thinking about ways to creatively go into the community to reach fathers and meet them where they're at, whether that's at community centers and churches or service delivery centers, whether child support offices or health clinics. We're going to talk a little bit more about some partnership ideas in a moment. This is also about highlighting the importance of fathers to their children's outcomes. And this can be of particular importance when we're thinking about programs that may, as Emily mentioned before, historically serve mothers and children, perhaps say a women, infants, and children's nutrition program. We talked to the California WIC Association, which highlighted how they really tried to emphasize the benefits to child development, to the health and well-being of the whole family when fathers are involved in coordinating services with their children in WIC. So this can be a way of getting more buy-in, greater participation. The third bullet here, increasing male staff participation, is something that rang true for a number of organizations that spoke to us. For example, we heard from the Mecklenburg County in North Carolina, their Child Support Enforcement Office, which conducted a survey, reached out and got data from fathers that had pre and post orientation to the program and heard about what their impression of it was about the child support system in the county. And they really thought that the system was working against them and they weren't comfortable with discussing their financial circumstances, their family situation. And through gathering that data, surveying and hearing from dads, they identified what needs and preferences that fathers had in terms of the kind of engagement that they'd like to have with the program, and determined that one priority would be to hire male staff that had a range of life experiences, were married, engaged in the community, could share the kinds of experiences and connect with the dads on a level that worked for them. So we can shift to the organizational level now. So at the organizational level, again, we're kind of thinking, as Emily said, a bit about organizational leaders and also how across an organization that may or may not exclusively deal with fathers, how father engagement can come to be an element that is seen as part of and perhaps central to an organization's mission. And there are different ways to do that and to leverage the resources that an organization has while being able to take on more given limited resources. So some of those may include leveraging community partnerships. We have a case study out. We'll highlight some of these initial resources from our project later. One of these is a case study of a rural Ohio fatherhood program that determined there was an opportunity to partner with substance use treatment centers in the community, both residential and non-residential treatment centers. And they did this by acknowledging and identifying opportunities where building a fatherhood curriculum into the substance use treatment program structure could help improve outcomes for participants in both, who had interest and were participating in both programs. And they adapted their curriculum accordingly to be able to make that work. This organizational level approach may also involve aligning father engagement with the organization's mission. I mentioned in the previous slide about the program level, the value that can come from hiring and increasing the representation of male staff among an organization's staff. But there's also value we identified in training all staff to engage fathers and making sure that there's competencies across staff who may deal with a wide range of clients, and thinking about the kind of preconceived notions or biases that staff may come to the work with, and thinking about how to, across different areas of an organization's mission, build father engagement principles into that work. And then one other piece to highlight here is this idea of collecting data for continuous quality improvement. And one good takeaway that I think is worth highlighting here is that, maybe in an ideal world, we can collect a full data set with a range of data points that we can analyze and think about how to better engage fathers. But some organizations really said one thing to start with, if we don't have the resources or capacity to do that, is to just look at some of the basic pieces of data that we do have. Is a dad coming in with his child to get services at WIC? When is he showing up to the organization? Record that as a touch point and think about that as one opportunity for identifying areas for potential increased engagement. Let's touch on the system level for a second, and then we'll move to just briefly talk about one other case study. At the system level, this is important, right? Because all programs and organizations are operating in a systems context with policies and laws and regulations from states and local or federal governments. And so we want to acknowledge the importance of thinking about that, working in a federal office ourselves, but with our state and local partners, and trying to get feedback from our programs and organizations implementing their own work on the ground about what the barriers are, how we can review intra-agency policies to ensure that they're father-friendly, aligning policies across programs where possible to reduce barriers to engagement. And then finally, kind of recognizing the importance of having fathers' voices at the table when we're making decisions about fathers, including their perspectives. If there's an opportunity to, several states have statewide fatherhood commissions that bring together various different human services agencies and organizations that serve dads with fathers from the community as well, and try to identify and opportunities to break down barriers across the agencies, across the different policies. So finally, again, there's a lot more detail on these and some of the resources that we'll share, but we did want to give one more example of a particular case study that we did publish that you can look at on our website. This is a case study of the Fatherhood Pride program, which was established by the Healthy Start Coalition in Northeast Florida. So the Northeast Florida Healthy Start, they saw that there was an opportunity, and they wanted to do more father engagement. And so they established a program, and I think they had a few takeaways from what worked and what didn't. First, they saw in their experience that there was improved engagement by emphasizing a separate focus on fathers. So they did the work of thinking about how the fatherhood program would align with Healthy Start's core mission, right? And really emphasizing and getting buy-in from staff and participants and stakeholders in the community about the alignment between father engagement and outcomes, well-being outcomes, health and well-being outcomes for families. At the same time, right, they created a separate structure, a separate program that was intentional about how to recruit and engage fathers. And that was kind of in our definition up front, really making sure that we weren't just incorporating fathers in a passive way, but being intentional about the approach to engagement, such that we were being thoughtful about the way that we met fathers' needs. Developing partnerships with key systems was one aspect of the work. Northeast Florida Healthy Start, this Florida Fatherhood Pride program, they created an agreement with child support offices in the area to be able to send staff to the court where child support hearings were taking place, so that there was ready access for dads who wanted to or were ordered by the court to participate in different types of programming. And so Fatherhood Pride was able to engage with dads in that context, and also then build partnerships with nonprofits in the community that provided additional services to the dads to navigate the child support system. And then finally, the last part I want to talk about is the Fatherhood Pride program made some adaptations to its recruitment and intake process over the course of its programming. They were seeing that there was a lower completion level to the program than they would like. So they looked at the intake process and they did a couple things. They first really tried to describe up front what the commitment level was for the fathers who were participating in the program and tried to get their buy-in to it. And then they also asked fathers to identify some key members of their social network who might help to support the father and help them complete the program, and ask for the permission when possible to contact the members of the dad's social network to try to encourage and provide support to increase the completion rates. And what they found was over the course of the several years that they were running the program for 5 years, the first few years of the program, they had a 45% completion rate. They saw that move up to about 70% after improving its and making these changes to the intake process, while continuing to serve the same number of fathers. And that was partly due to these extra supports that they encouraged, as well as making sure that the fathers that they identified that had additional needs were targeted for additional support from the Healthy Start program as well. So I'm going to leave that there. And again, we'll share these resources with you so you can take a closer look if you'd like later.
Great, thank you, Matt. So as Matt was just saying, we have 3 case studies that are published, and these are just a handful of some of the products that we have developed and are continuing to develop. And so here's kind of a brief overview of the case studies that we have that are on our website. And I don't know if Matt, you want to drop the link to our website in the chat, that would be great. But we looked at father engagement across various program settings. So the first one is father engagement in substance use disorder treatment programs. And that one identifies lessons about engaging fathers through community partnerships. And that draws in an example from rural Ohio and their fatherhood program that developed partnerships with a local substance area use disorder treatment program. Our second one is what Matt was just talking about in the case study example, so father engagement in Healthy Start programs. And that really highlights approaches to increase father engagement through the intake process and by leveraging fathers' social networks. And the third one talks about father engagement and family nutrition and health programs. So that one looks at the California WIC Association and talks about how system level actors, such as statewide associations, can support local programs and involving fathers in programming, including programs that historically have focused on women and children primarily. So other products you can look for coming up. We have an issue brief that will be coming out. We're hoping within the next month or so. And that really takes a deeper dive into the framework that we talked about a little while ago. We have some fact sheets that are coming out as well on COVID and child support and how programs have adapted to still continue to meet the needs of fathers during the pandemic. And we also have some podcasts that are coming out as well. We have one that's actually out right now with Mathematica. It's on their evidence podcast, and that can be found on any of your normal, I guess, streaming services where you find podcasts, but that really focuses on father engagement during the pandemic. So would give that a listen, and we'll have another one coming out soon on father engagement and Head Start programs as well. So thank you so much for your time. We really appreciate being with you all here today.
Thanks so much, Emily and Matt. It's such a rich study. There's so much in there that's helpful. And I especially think that the case studies are really helpful and kind of written in a way that could be very valuable to programs. And we look forward to kind of seeing your definition in print and the broad framework in print. I just wanted, we do have some discussion questions, but I first just wanted to open it up in case anyone had questions for Matt and Emily on the approach that was presented today. So I think folks can also kind of, we'll have a couple minutes at the end also in case anyone thinks of something. And we'll also send around the published resources that Matt and Emily just talked about, that Emily just presented a moment ago, so that you have easy access to them. I'm going to share my screen for a minute because we have some discussion questions and we wanted to be able to let folks have some discussions with colleagues in small group, have a few minutes to kind of reflect on this research and how it could relate to the work that you all do. So let me just share my screen for a moment here. Let's see. Sorry. So here are the questions that we wanted you to think about, and I'll put these in the chat as well. So thinking about this research, the KEEP presentation that Matt and Emily just did for us, take some time to discuss your father engagement strategies at the program, organizational, or systems level, depending on where you fall in the system. And here are the questions. What engagement, recruitment, and retention strategies have worked? What challenges have you experienced in engaging with fathers and father figures, and what would be helpful in moving your work forward? So I know that not everyone is going to be able to speak to each of these questions, but I thought it would be just great to have a little exchange with colleagues. So Carrie is going to go ahead and just assign us to breakout sessions right now so we could dig a little bit deeper into these topics.
Thank you. This is Carrie. I'll go ahead and launch the breakout rooms. And Pamela, can you just let me know the timing?
We'll have 10 minutes to talk about these, and then we'll come back together as a large group. And then while you're in the breakout rooms, if you could designate somebody to report back out on some of the top line messages, that would be great.
Okay, great. I'm going to go ahead and open up all the rooms. You should see a join button on your screen. If you don't see it, if you click down at the bottom, there is a breakout room icon.
Know what else is coming up, and we'll just kind of hold on to our, kind of keep processing what we heard today and send the follow-up resources from today's session, and hopefully we'll see folks back in upcoming sessions. We are really excited to engage with you on the next few Thursdays. We will hear from a really wonderful advocate with lived experience next week who's done a lot of work in Pennsylvania and Allegheny County. He's a trainer and a coach and a consultant, and he's just worked for many years to engage programs, particularly in the substance misuse sector. So we're really excited to hear from him. And then we have our friend Ricky Trainer, who's done a lot of work in Milwaukee and also at the state level in Wisconsin, is going to come and talk to us about working with fathers and father figures from special populations. And we're going to close out our community of practice with two folks from Rhode Island who are both dads with lived experience in multiple service systems that comprise our systems of care in early childhood. We're going to be talking about they have run a peer support group in Rhode Island for a long time, and they're going to be talking about how to leverage lived experience in their programming work. So I think all of this is going to be really helpful. We have some other NTAC events coming up. This one on trauma-informed approaches, a separate webinar that we have about that, can really help with the question that Karen raised about sort of how to incorporate ACEs screening or talking about adverse experiences into your practice and working with families of young children. And there's our community of practice coming up as well. So I know we're at time. I'm sorry there's not a lot of time. We would love some feedback on how this went and, you know, what else you all are looking for this community of practice. We really want to be helpful and offer some concrete resources. I really want to thank everyone for coming today. Thank you so much to Matt and Emily for sharing this very exciting emerging research. We will get folks the links to whatever has been published from the study, and then sort of the overall landing page for the study, so you could, you know, check when the other resources will be available. And right, just let us know what you think so far, the timing, and also kind of what else you would like to see in terms of resources to help with all of your work. Thanks so much, folks. I'm really excited to work with you all.
Thank you.